us in the real for many years, and then she did this dreadful thing called get married. And her husband moved her to Orlando, but thankfully to modern technology, she virtuals in. But this is the real Megan. I don't know.
One day I might just be a hologram. Can you imagine?
You're welcome. Anyway, so we're gonna be chatting today about some of the offerings. I think it's been exciting for me to be in practice in this sort of time frame. It's now 2 decades I've been in practice, which is pretty impressive. Anyway, but I basically seen the specialty go from a total focus on surgery. So it was either surgery or nothing. And now there's all these, as Megan talked about, tools in our toolbox, where there's a lot of non-surgical things that we can do that help bridge that gap. So I think as we move forward, I'm going to talk about some of the things with skin and why we care and kind of what our philosophy is. Number one, your skin starts aging the moment you exit your mother's womb. That's so exciting. Okay, but anyway, but the point is you may still look good by the time you're 30, but that you're going to have accumulated some dead skin and some dead layers. Okay, so basically you're going to have about 15 to 30 layers of dead skin on you by the time you're 30 or 40. So having said that, it's, paying attention to skincare is important. It's not just about having good looking skin, it's about having healthy skin, because the last thing you want is a hole in your face because you've had a skin cancer. So that's sort of the ultimate motivation for doing it, right? Okay, so our philosophy of skincare and about rejuvenation is sort of looking, again, as Megan said, the whole person. So I'm going to be looking at someone's skin, the texture and tone, and where they may or may not have too much, whether that's in the upper lids and brow area or the neck area. We're not talking about below the neck today. If you want to talk about below the neck, we can, but we'll do that in back. Okay, but having said that, so we're going to look at the skin, texture, and tone. That's where I work closely with Noelle to come up with a skincare regimen. And then our technologies like our peels and Lumeka and Fractor and Forma are all some of those new technologies that have come about that help with that. I do want to address the sort of peel thing. A lot of times people hear the word peel and they think about burning and acid and pain and redness and rawness and weeping. Sounds gross. Okay. And that indeed was what characterized peels of the past. The VI peel is novel, and that I think I can say it's painless. I've had it done a couple times now. I would say the most obnoxious thing about it, at least for me, is sort of the smell of acetone as you get your skin degreased. But other than that, it doesn't really feel like anything. It's, it's just touching your face, you put stuff on it, then she's like, toodaloo, see you later, and you move forward. You do get a nice peel, but there's no rawness, there's really no pinkness, there's no pain. Okay, so it's great. It's the reason why we're sort of launching it, because we do like it a lot. Okay, so then the other part of facial rejuvenation is looking at soft tissue, and that's where fillers and Botox play a role in softening some of those facial expressions that make you look angry or mad when you're actually quite happy. And then on the structure part, that's a relatively new element been able to introduce, is this notion of using filler to either replace or place a structure where someone's lost it. Certainly we know about people losing height as they age, it's bony loss, and you lose the bone in your spine, you're losing your face as well. And so you'll see, if you didn't have teeth, we've seen pictures, if not, if you didn't have great grandmas who did have missing their teeth and their jawbone gets very thin. So the point is we can lose bone anywhere, and we do tend to lose it at the ankles, and we lose it around our eyes, around our nose. And so I think about structure is key. If you think about a tent that has its sort of center pole, and the fabric is nice and tight because the pole is high, what happens to that fabric if I lower that pole? It sort of sags, right? And that's what happens a lot of times on faces. So those are sort of the 3 elements, and we're going to kind of walk through each one. So what can peels accomplish? And this is a list of those things. So we're looking at texture of things. We're looking at evening out what we call the spotty dotties. We're looking at improving the tone of the skin. And so a lot of times, again, things in combination work better than things alone. And I think it's important when we're talking about, I'll say, rehabilitative, rejuvenating skin. This is a lot like getting a personal trainer to help you get in shape. If you're gonna spend the effort to get a personal trainer, you don't just meet with them once and go, oh, I'm all done, I'm in shape. You've gotta be consistent, and it's gotta be something you understand is gonna easily take on personal trainer, depends on how out of shape you are, but it could take easily 6 months to a year. And getting your skin in better shape, again, it depends on where you're starting. And so obviously prevention is the best tool, but if not, if you're starting off with a fair amount of sun damage, you need to understand there's not one treatment that's gonna magically make all sun damage go away. It is a process, okay? The VI peels, they come in different categories, and so they're like what we call beginner peels. There's things that are focused on acne, and then there's things that are focused on fine lines and wrinkles. This is an example of a gal who just had one peel. And I told you that one peel wasn't gonna make everything magically better, but one peel does a fair amount. And so you can see your skin just looks dull. I mean, this just sort of looks like skin that has a lot of, layers of dead paint on it, okay? And you can kind of see these spotty dotty. So the peel does help even out skin tones, and this is sometimes where we use things in combination. We may use a peel in combination with a photofacial or the Lumeka to help even out skin tones. But you can just see overall, this is just happier looking skin. Our face, as we age, sometimes projects, it's sort of like a weather vane, it projects a attitude that you don't really feel inside. So a lot of times I'll have folks, men and women, say, at work they keep saying, why are you so upset? And I'm like, I'm not really upset. Well, and I guess they're getting upset because I'm telling people I'm really not upset. So the importance is that we can help make your outside match what you're truly feeling, or as one teacher said, you take it all away so nobody knows how mad I am. That's another way to look at it. Okay. But Botox can be used in lots of different places. Most people are familiar with its use in the upper face and the 11s, the crows, and the forehead. But it certainly can be used in the lower face. There's a muscle here called the depressor anguli oris. That's my Latin for the day, the DAO, and it pulls the corners of the mouth down. And so that it can be used on some neck issues. This is just an example of what Botox can do as far as softening lines and wrinkles. I will say there are limitations to what Botox can do, okay? So it is a good prevention tool, it's a good retraining tool. If you sort of have a facial habit of squinching your eyes up to show you're concentrating, this kind of helps you retrain. But once a line is pressed in the skin, right, sort of like a paper clip, you bend and bend, bend and bend, eventually it's gonna break. So if you're pressing the skin by continuous, frequent muscle action, you're gonna press a crease or line or essentially a scar on the skin. So sometimes people have one of those and they say, well, I want you to take it totally away. I can't. That skin has been permanently, essentially scarred by that repetitive action. Can we soften it? Absolutely. Are there other things we can do? Yes, but it isn't going to be a Botox only thing. So sometimes we will use Fractora, we can use peels to help soften that. So I think it's matching your what we can really do with what you want it to do, right?
Dr. Brown, there's a question.
Yep.
So is that a vertical you're talking about? Or
Yes,
horizontal?
11. Yeah.
So horizontal you can't.
So on foreheads, okay, so that's going to be a good question. When the 11s, the verticals, the crow's feet, all of those are from muscles that pull things down. And I am completely okay in getting rid of all down muscles, okay, fighting gravity. The muscles that cause your horizontal forehead lines, that is that muscle is pulling things up. You've got to be very careful about making someone's forehead immobile, okay? And so that's part of, I guess, the advantage of being a surgeon who does brow lifts and eyelid surgery versus someone who's a provider like a dentist who doesn't do that, is I've had folks, I mean, it's pretty routine. People are walking around with their eyebrows held up, okay? And making those lines because they're compensating for the fact that their brow is really low. So they're using their forehead, like they're pulling up their forehead on the hair bridges that's dragging around. Now, on that, if you have forehead lines for that reason, and you think we're gonna fix it by putting Botox in, now sure you can put in Botox, you're gonna mobilize that forehead, what's gonna happen? That brow is gonna fall, that person will not be able to see out properly. And I had this, this gal had many decades on anybody here in the room, but she had had that done. So they were using Botox to treat the symptom as opposed to dealing with what was going on, which is she needed a brow lift and upper lids done.
So that would be
She could not see. She literally, it dropped her brow so far that she had to hold her, to see out, she had to hold her brow up until it wore off, and then we ended up doing surgery on her, okay? So a brow lift, there was the old-timey way from ear to ear, but in general now, the brow lifts I do are going to be called endoscopic. There are 5 little buttonholes, 1, 2, 3, 4, 5, and we use that as a means to reposition the brow to its original position.
So Botox, mostly just.
I will use Botox here in the forehead, so I will use in the up muscle, but carefully. And after assessing what is that person's eyelid brow anatomy, not just blindly, oh yeah, let's just, okay.
That was a good experience for me.
Okay, good.
You weren't that bad.
Okay, good, you can see.
Oh,
Yes.
Okay. Okay, so I'm gonna move, anything else about, I'm trying to think if there's anything else on Botox. The only other thing I would say about Botox is sometimes people will say it's not working, and it can be, number one, you shouldn't be going to get your Botox every 8 weeks. That's too short of a time frame. Number two, sometimes if you're low on zinc, and a lot of people are low on zinc, it may not last as long. Okay, so if you're finding that, I would say, well, try some zinc supplements and see if that helps. Okay, filler. Okay, sometimes people, how about this? We all are on budgets, and I'm aware of that, but it's important to understand what your budget is and not short shift yourself, right? So sometimes people will say, well, I only have a budget for 1 syringe of filler. Now, understand 1 syringe of filler is 1/5 of a teaspoon. Okay, it's 1/5 of a teaspoon, which is less than 1/2 of a teaspoon. Okay, so it's 1/5 of a teaspoon. It's not very much. Okay, so the point is if you only have a budget for 1 syringe, 1/5 of a teaspoon, I cannot use that to fix your entire face. And if I try to, you're gonna say that filler doesn't work. Okay, well that's sort of like saying I have 1 tablespoon of icing and I'm gonna decorate your entire wedding cake with that. It's just not gonna work, okay? So I think that's important, and I mean, I explain that to folks, but not, sometimes I have folks say, oh, I got filler so-and-so, and that stuff doesn't work, and then I have to sort of say, okay, well, how much did you have, where'd you have it? Well, I had 1 syringe, where they did here, and here, and here, and here. I'm like, well, of course it didn't work, you're trying to spread it out too thin. Okay, the other thing about filler is anyone can dump it in, okay? And so that's, the dumpers of filler are those pictures that we hate, or I hear people say, oh, I've seen girls that have this, where you have little apple dumpling cheeks, or, blubber lips, okay? So the important thing is that you want someone to do it who knows the whole facial anatomy, okay? And so there's areas where we can use fillers. It can be used all over the face. Now the important thing about fillers, if you go back to that pie chart, is we can use fillers both as soft tissue, so around the mouth and the downy frownies, and we can use soft filler as structure. It's the same filler. It's a slightly different technique, but the important thing is where I'm placing it. So as structure, I'm placing it under the muscle next to the bone, okay? I'm gonna talk about filler as soft tissue, so we're gonna talk about lips, and this is what nobody wants, okay? This is what what a lot of people are afraid of. We live in a relatively conservative place, and in general, most women in this community are not interested in lower lips, okay? So, but I think what's important is to recognize that beauty comes in many different faces, and all of these are beautiful women. But if you look, besides their skin tone, their lips are all slightly different. So you have this gal who is relatively thin upper lip. You have this gal whose upper lip was fuller. So you have the whole range, right? And you can have lips, upper lips and lower lips that are basically the same width, okay? And that is appropriate if you are in this group, but these lips on this gal is not natural, okay? So I think that's one of those things in dealing with lips. Now sometimes, we don't have it that much here, but I hear people like bring in a picture, I want my lips to look like this. But you're not that person. So the point is my goal is to get your lips as pretty as I can get for you. And sometimes the limiting factor is your lips, right? I can't take them past a certain point. And so when we're talking about lips, the whole notion is to keep things in harmony. So this is a side view of what is, I'll say, an attractive lip. And so this is, you can see that as her upper lip swoops down, the pink part of her lip is nice and round here and curls around. Her lower lip is a little bit fuller, and you can see as you come in from her lip, the pink part of her lip actually swoops out, okay? What's happening here? Everything is rolling in, okay? So this is a pretty gal. She looks more masculine than her. And the reason is her brow is getting a little bit heavy, so that's where ladies start looking masculine, a little bit heavy in the brow, and the lips are a little bit thinner. So for her, I would say now, you can tell she doesn't need big lips, she really can't have big lips. So that's another point. There's a difference between big lips and full lips, okay? So if you have a nice big juicy grape and a smaller juicy grape, and you put them both in the refrigerator, what's gonna happen to them over time? They're gonna shrivel up, okay? The little one will shrivel up littler, and the big one's gonna shrivel up, but it's still gonna be a little bit bigger than the little one, but they're both gonna be shriveled, okay? So that's what happens with lips over time. So the whole point is that we wanna restore what you have, but we also wanna keep it consistent with your features. This is an example of a gal who's starting to look a little bit masculine. Her lips are, she's just lost volume. She has decently, I'm gonna say size lips. She's a little thinner on her upper lip than her lower, proportionally. And she's a little bit shiny here because we just got done, but you can basically see we've restored what I'm gonna call the Cupid's bow in through here. So this is anatomy. A lot of times what happens is ladies age, they lose their Cupid bow, those lovely undulations of the upper lip, and basically you get what I'm gonna call simian. Simian is the word meaning ape-like. And so the whole upper lip is just one round surface that has no undulations whatsoever, okay? We interpret that, it's a subconscious interpretation of age, okay? So restoring some of these landmarks, this just starts looking more youthful, okay?
What about little lines?
The little lines are gonna be, that is gonna be a skin texture and tone thing. There's times when chasing after all of that with filler, I don't do. I'll use filler to create a nice shape for the upper lip, and I'll certainly use filler to create a Cupid's bow, which is what we've done here for her. But I would use skin peels, Fractora, I would use technology that address the texture and tone of the skin for fine lines and wrinkles. If you're gonna spend your money, right, I would rather, your money's gonna be more effective putting it into the texture and tone of your skin versus spending on a syringe for me to try and get, because it's just really not gonna work that well. This is another gal, again, she naturally has thinner lips. She has what you're talking about some of these lines. Now, I just made myself a liar. So we put some volume in her lips. Those are not quite as evident, right? Okay? Now she still has texture tone issues, but her lips look softer, okay? And then this is another gal. So again, like if you remember that other picture, her lip is just sort of rolling in, and here we've just softened it. I've not made her huge lips, but I've just made it softer. Now I'm going to talk about moving from filler for soft tissue to filler of structure. And so then this is what we're going to call as a non-surgical restoration of structure, and this is a Ylift. And so you can see on this gal, I mean I did around her mouth too, but we basically used it next to the bone, and I put it into this jowl area and on back on her jawline, and I put it in through here, and of course I did some stuff here. And you can see that is afterwards. And so it's just a restoration of her structure. I did not remove any skin. I didn't do a facelift. I just restored the structure. And like that tent pole, I put up the tent pole, right? I put it in as structure, and it stretched that fabric over a nicer framework. We can use this same principle in smaller areas on younger folks. This gal never had a really good structure, right? She's a young gal, and she just has sort of an underdeveloped jaw and chin. And so then this is just with one syringe of filler. Sometimes one syringe can do a lot, but it has to be a very concentrated and in the right location, okay? And so this is, old and young life. Okay, so this is a gal who needs some skin work done for sure, but we basically used filler structure on her and just did it right here and around her mouth, okay? So and you can see she has a nicer, looks like she has a jawline now, as opposed to everything sort of sliding. So I'm just gonna refresh, so we're gonna put it all together, and the whole point is, each person I see, there may be an area that either bothers them a lot, or I think should be a priority, right? So you can have someone who has really good structure, but they have horrible skin damage. Well, I want them to invest their time, effort, energy, and budget right here, because that's where it's going to get the most results. So that's what the goal is, to come up with a very individualized plan that suits that person's anatomy. We're going to work with their budget, because Rome wasn't built in a day, so we don't have to get perfectly beautiful in a day either. And that is appropriate for them. So I'm almost done, and Angela is sitting in the back, so you can chat with her. But this is kind of putting it all together. And so she initially came in. Are you okay sharing your story?
Oh, yeah.
Okay, you want to tell them why you came in?
Oh, okay. Well, initially I came in because I was starting to have trouble seeing, because my eyelids